The erosion of trust in vaccines has now reached a crisis point, and the consequences are unfolding in real time. Once nearly eradicated diseases such as measles are resurging with alarming speed, and seasonal threats like influenza are claiming lives at rates that should no longer be considered acceptable in the modern world. Decades of medical progress are being undone not by scientific failure, but by the willful rejection of proven public health measures. This isn't just a matter of personal choice. It is a public health emergency, one that places the most vulnerable members of society at grave risk. The refusal to vaccinate, often fueled by misinformation and ideological stubbornness, has created a new kind of epidemic, one of preventable disease outbreaks, unnecessary hospitalizations, and deaths that never should have happened. The numbers paint a bleak picture. Measles cases are appearing in clusters across the country, fueled by declining vaccination rates in specific communities. Just a few years ago, the disease was considered virtually eliminated in the United States. Now, with immunity thresholds slipping, it has reemerged as a persistent threat. This is not a benign childhood illness. Measles can cause severe complications, including pneumonia, encephalitis, and even death. The worst part? Every single case of measles today is preventable. It is not a mystery disease with an unknown cure. It is a direct result of vaccine hesitancy and refusal. Influenza, another illness that should be manageable, continues to kill tens of thousands of people each year. Despite the annual availability of flu vaccines, millions of Americans simply choose not to get immunized. The result is predictable and devastating. Hospitals filling with flu patients, overwhelmed ICUs, and an increasing number of flu-related deaths, particularly among the elderly, young children, and immunocompromised individuals. These deaths are not inevitable. They are the byproduct of complacency, misinformation, and a growing distrust in medical expertise. The reasons behind vaccine hesitancy are numerous, but they often stem from the same toxic sources: conspiracy theories, social media echo chambers, and a broader cultural shift towards skepticism of science and institutions. In some cases, vaccine refusal is driven by outright misinformation, debunked claims about vaccines causing autism, infertility, or other long-term health consequences. In other cases, it is a misguided belief in natural immunity, an argument that ignores the brutal reality of suffering through preventable diseases. Still others refuse vaccines under the guise of personal freedom, ignoring the fact that their decisions have direct consequences for those around them. One of the most disturbing aspects of this crisis is the burden it places on healthcare workers, who are forced to battle not only the diseases themselves, but also the misinformation fueling their spread. Nurses, doctors, and public health officials have spent years trying to educate the public, only to be met with hostility, harassment, and outright rejection of scientific facts. The exhaustion among medical professionals is palpable. They are fighting a war on two fronts, against the viruses themselves and against the deeply entrenched falsehoods that allow these viruses to thrive. The broader consequences of declining vaccine confidence extend beyond individual illness. They threaten herd immunity, a fragile barrier that protects those who cannot be vaccinated due to medical conditions. Infants too young to receive vaccines, cancer patients undergoing treatment, individuals with immune disorders, these are the people who suffer the most when vaccination rates fall. The irony is that those who refuse vaccines often do so with the assumption that they are making a decision only for themselves or their children. In reality, they are making a decision that endangers entire communities. This crisis is not limited to the United States. Globally, vaccine hesitancy has been identified by the World Health Organization as one of the greatest threats to public health. In recent years, Europe has seen multiple measles outbreaks, some of which have resulted in fatalities. In developing nations, where access to vaccines is already limited, the impact of vaccine refusal in wealthier countries is particularly egregious. The developed world has the means to eliminate many of these diseases entirely, yet instead, it is allowing them to make a comeback. The question now is whether anything can be done to reverse this dangerous trend. Public health campaigns, educational initiatives, and stricter vaccine mandates have all been proposed as potential solutions. However, these measures face significant resistance from anti-vaccine groups who have grown increasingly vocal and politically influential. Social media platforms have been slow to combat vaccine misinformation, and in some cases they have actively contributed to its spread. Meanwhile, lawmakers remain hesitant to impose stricter vaccination requirements, fearing backlash from vocal opposition groups. The reality is that turning the tide on vaccine hesitancy will require more than just education. It will require a fundamental shift in public attitudes towards science and public health. It will require confronting misinformation at its source, holding social media platforms accountable for the content they amplify, and reinforcing the social responsibility that comes with living in a community. It will also require stronger policy measures, including stricter vaccine mandates for schools and workplaces. The alternative, allowing vaccine-preventable diseases to continue their resurgence, is simply unacceptable. The crisis in vaccine confidence is not just a health issue. It is a societal failure. It is the result of years of neglecting science education, of prioritizing individualism over collective responsibility, and of allowing misinformation to spread unchecked. The consequences are now unfolding in hospitals, in classrooms, and in grieving families who have lost loved ones to illnesses that should have been prevented. If this trend is not reversed, we may find ourselves in a world where diseases we once conquered become a permanent fixture of daily life, an outcome that would be as tragic as it is unnecessary.